There will be a surprise outbreak. Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak.
So if you hear the word Deltacron, you probably think that's something out of a sci-fi movie. Well, actually, it's what health leaders in the country of Cyprus named a new strain of COVID-19. You see, doctors found in more than 24 patients over the weekend combining mutations from both the Delta and Omicron variants. 11 Alive's Don White is breaking down what this means and why it's not an official variant yet.
Scientists in the European country of Cyprus believe Deltacron is real because of the mutations from both Delta and Omicron being found in mostly hospitalized patients.
If we had the overwhelming majority of people in this country vaccinated and those who needed to be boosted, our vulnerability would be much less than it is right now.
The long-term picture is just really not all that clear, but there are some hints as to what may be going on. And I think people should not rush to conclusions and should recognize that this kind of information is going to be forthcoming on a regular basis.
200,000 dead. As you said, over 7 million infected in the United States. We, in fact, have 4% of the world's population, 20% of the deaths. 40,000 people a day are contracting COVID. In addition to that, about between 750 and 1,000 people today are dying. When he was presented with that number, he said, it is what it is. Well, it is what it is because you are who you are.
If we would have listened to you, the country would have been left wide open. Millions of people would have died, not 200,000, and one person is too much. It's China's fault. It should have never happened. They stopped it from going in, but it was China's fault. And by the way, when you talk about numbers, you don't know how many people died in China. You don't know how many people died in Russia. You don't know how many people died in India. They don't exactly give you a straight count, just so you...
Look, you folks at home, how many of you got up this morning and had an empty chair at the kitchen table because someone died of COVID? How many of you were in a situation where you lost your mom or dad and you couldn't even speak to them? You had a nurse holding a phone up so you could, in fact, say goodbye.
Stumbled at the start line, I've done all that I can do, but I'll try again, I'll try again. Stay on the straight and narrow, we'll meet up at the end. Cramped up on the inside at the thought of losing you, but I'll try again, I'll try again.
I could have climbed all over him, but wait, get your Addie. Bookworm study. Girl, that's all you do? Yeah, that's all she do. That's not what your doctor.
Jennifer, do you ever go home? Do you even still have a home? And yes, this is all I do, unfortunately, like YouTube. And I appreciate y'all keep the noise down. I do have a very important test tomorrow. And why don't you guys have my mask? You have the COVID, right?
I do have my mask, thank you. Don't come for me, okay? See, that's one girl that need to have some fun. She too uptight.
I can't believe you two. The virus is very contagious. and spreading like a wildfire, and y'all taking it like it's a joke.
The timing of this rapid rise of infection is concerning, with holiday gatherings and travel just days away now. Thousands in the city want to get tested, and they're waiting in long lines to do it.
Angel, why you don't come out with me and Jen tonight? Because I got work and school to concentrate on. All you do is work and study. I mean, come on, girl. It'd be like old times. Come on, and plus I still owe you that birthday dinner. N-O. Listen. We are only going to a juice bar. Ain't gonna be no smoking, no drinking, just some good looking fellas. Get our party on like you used to. I'll think about it, and I'll let you know by the time I get off work. I'm telling you now, I'm not staying out late. Okay, girl. Promise. Mask on all night. Throw it outside. Throw it outside. Throw it outside. Please stop singing before I change my mind. Okay. Because you sound terrible. See you later, girl. Later.
Under pressure, no more time. Can we make a move? Overthinking, you and I. What do we have to lose? 'Cause I'm wasting all my time thinking of the things we could do. If you gave me one more sign, I could find a way to break through. A way to break through. A way to break through.
Or you're shouting in a nightclub because you can't hear your friend, and you're saying, you know, can you hear me? And you're close by and you're projecting your voice at someone, then it's clear that in that situation, if the virus is present in your upper respiratory mucosa, then there's every likelihood that you can project that virus.
I think we came home with something. I don't feel good either, girl. I feel like something running through me. Could have been that dude, Omarion. Girl, COVID? Please don't say that. Oh, no. We can't have that. You okay? I can't breathe. You can't breathe? What do you mean you can't breathe? You want me to call 911? Girl, you are shaking. Okay? Yes, I am. I'm calling 911. Hello? Hello? Yes, please. I need the ambulance to 23 Jackson Ave.
Are there cases of vaccinated individuals dying from COVID-19?
Absolutely there are, and people need to remember the context, the perspective here. Vaccination against COVID-19 or any other infectious disease for that matter is not 100%, but think of it like a seatbelt. It does as much as you can possibly do to help prevent a death. Than compared to not doing it. So we do have data from November and December in this country that people who were unvaccinated were 15 times more likely to die of.
Oh my God, it's okay. Hey, girl. How you doing? So, I'm fine.
Right, why you sitting with that darn mask on? I ain't got no COVID no more.
Look, I'm just trying to be sick. I'm not trying to get sick. Anyway, how is Angel doing? You heard from her dad?
Yeah, she good. She's still in the hospital, but they took her off the respirator or whatever. She breathing on her own, so
that's what's up.
You know, it's a good thing. I'm freaking can't wait. I miss her so much.
We gotta make sure
I feel so bad, yo.
We gotta make sure we take care of her this time. For
yeah,
real.
we are. You know it.
Yep,
That's
really
my
miss
girl.
her.
I miss her. She coming on home. You know the shit.
Well, you gonna call her what time you like usually call her?
So, what? What's up with her? It's the hospital calling me.
Maybe it's sis. Maybe her phone died. See what's up.
Hello? Yes, this is she. Yeah? Yeah? No!
Sis.
No! No!
How do I say goodbye to what we had? All the good times that made us laugh outweigh the bad. I thought we'd get to see forever, but forever's gone away. Yeah, it's so hard to say goodbye to yesterday.